Hi, my name's David Jansen,
And I'm Mbechi Arandu.
and we're going to tell you about the 6-week surgery clerkship here at Iowa Methodist Medical Center in Des Moines, Iowa. So I'm not going to lie, hours on surgery are pretty long. Your day usually starts sometime in the early morning. Usually I had to be over there around 4:30 or 5 to start seeing patients. You're assigned to anywhere from 1 to 3 patients that you go see in the morning. You go in before the residents get there and you see how the patients are doing, and write a note quick. And then you usually round somewhere between 5:30 and 6. You round with the residents and it goes really quickly. And then surgeries usually start around 7 o'clock. You could be in the OR all day long, or you might also have some time for studying. It kind of depends. You might go home around 3 o'clock. You might go home around 6 o'clock. It kind of varies. The good news is that you don't ever have to work on the weekends here. That's something they built into the surgery clerkship to give you an opportunity to relax and to study.
So here in Des Moines, you'll be assigned to one of 4 teams. The first is vascular, the second is oncology, the third is peds transplant, and the fourth is colorectal. Now, halfway through your 6 weeks, that's when you would switch to your second team. You're also going to be assigned to about 1 or 2 residents on that team. You'll also have an attending physician. Sometimes they rotate. You might work with one attending surgeon one day and another one another day. Some surgeons have specific surgery days. Others have clinic days that you might even be able to join them in. At the end of the day, you might even round with some of the attendings. I thought it was a wonderful experience.
One of your responsibilities while during your surgery clerkship is that you'll take call 4 times. And something cool at Des Moines is that the call that you do is actually trauma call. So you're hanging out with the night residents, and whenever there's a code blue, you'll sprint across the hospital and go help take care of that patient. Everyone gets ACLS training here, and as part of that I learned how to run codes, and so it was really cool being able to do that myself. Also, anyone that comes into the ER for a trauma, like a gunshot wound or a stabbing, you get to go down there and participate in the care of that patient, and you get to see some really exciting things. It's really a privilege actually to be able to take that call, and I really enjoyed it.
Alright, so what happens in the OR? Well, first things first, you're going to need this, a mask. Second thing is something to tie your hair up. If you're a girl, probably looks like a shower cap. You might have seen it before. Men can kind of wear these cooler, I don't know what to call them, skull caps almost. Some women do that too. Second step is scrub technique. It's a really complicated, at least a good 15 minutes of washing your hands. You'll learn that during the clinical beginnings week. Second step would be step in the OR. Don't be afraid. You might be the first one there. There'll always be staff, nurses, the surgical tech, the anesthesiologist, and sometimes you'll be waiting for your patient before your resident even gets there. So a lot of times my job was to text my resident and make sure that he or she was down there before the patient got there. Once the patient was there, we'd make sure to get the patient onto the operating table, get them prepared for surgery, make sure to get our gloves, make sure to get our gowns, and then we start. And usually as a medical student, your number one priority is to stay out of the way, try not to get dirty, try not to get the patient contaminated. Once you master that, the second step is maybe retracting, and what that means is if there's an organ or a piece of skin or whatever that needs to kind of be held out of the way and clearing the field, that will be your responsibility. Once you graduate from that, they might let you actually dab up some blood, suction, and even suture. And we do actually have a suturing clinic here in Des Moines. We were offered it at least 2 or 3 times and got a chance to practice and even compete against each other for a Starbucks gift card. I believe it's $25. So that was motivating enough. But then, yeah, once you learn that technique, oftentimes the surgeon will say, hey, you and the resident, go ahead and close. And it'll be you and the resident just helping each other out, cleaning up the patient, waking them up, and taking them back to the recovery room. So, I mean, I loved it. I love the OR, and I think you will too. Choose Des Moines.